So, welcome to this episode of Crap No One Tells You. With me today is Samantha Hainer from My RN Advisor.
Hi, Gummy. Thanks for having me.
Welcome. So, we're not going to waste any time. We'll just dive right into it. What is some crap no one tells you about being a nurse?
Oh, gosh. The stories I could tell. I guess the thread I'd follow is being a nurse is it's just such a powerful position. Personally, the value it brings to society, it's such a vital role. That is probably one of the hardest things I've ever done in my life. It drains you to your core.
You make it sound so exciting.
It doesn't sound exciting the way I'm saying it, but I mean, the point is it is, I don't know, I guess in some ways for me growing up, it was an idealized position, right? And the reality is it is that, but it's also all of this other crap, right? It's also you come home from a 12-hour shift and you're burnt out, and then other days you're burnt out, but you're so ecstatic because you've just saved two people. You've assisted in saving two people's lives, Other jobs, you're rewarded because you've helped somebody pass away gracefully, So there's just so many aspects of it that it's to each individual's own perception of what they take away, but it's the hardest and the best thing I've ever done. But that being said, more importantly, I think is it provides such robust opportunities for growth, for exploring different industries. I mean, there's nursing in insurance, there's nursing in the hospitals, there's nursing in home care. There's so many facets you can follow that it really, once you have the nursing degree, I mean, just so many doors are open to you.
Yeah, I don't think people realize in general that nurses are in way more places than they think.
I had no idea. I really didn't. And so that's one thread. But the other thing I feel like is really valuable for people to know and to think about, too, if you're ever choosing a career is, I mean, nursing is one of the only careers I came across where I can work 40 hours a week, can easily work 60 hours a week. I can pick up a per diem job. I can do a per diem job here, work a full-time job here, and then do something remotely over here with medical transcribing. Or, it just offers such flexibility that, from that perspective, from a life perspective, it allows you to grow, maintain your experience while maybe working minimal hours. What other 9-to-5 job,
Right.
Offers that? Well, nursing isn't 9 to 5.
No,
it's a 24/7.
Yeah.
It's a 24/7 job. But I mean, there's just so many aspects to nursing that I think just aren't out there in the public. And then there's different stereotypes about the different types of jobs. I started my career as a new graduate in the intensive care unit. I like to go hard and
Yeah, I was going to say, so you like to jump into the deep end?
I just like to jump into the deep end,
Okay.
Can I swim? This is how you best find out, right? And it was scary and rewarding. And in some ways, in some circles, being an ICU nurse or being an ER nurse really gives you a level of credibility. This is what people say, if you're not a hospital nurse, this is what I heard when I was starting out. If you're not a hospital nurse, didn't even specify which specialty, you're not really a nurse. It's what I was always told. Don't go to a nursing home, don't go to home care because, hospital's where it's at. You need that credibility.
So as a starting point.
As a starting point.
Okay.
It's not always possible to get into the hospital. Again, as things change, doors open up at different times in our lives. When I was starting out, it was hard. It was really hard to find a job as a new grad. Now, I was just hearing on the radio that, some states are changing the rules and their laws and allowing nursing grads
to start working
before they're even really graduated or even to get paid in school. I mean, you know what? Kudos to them. I don't feel any which way about that, but about them getting paid. But my concern is what you learn in nursing school is important, but it is so separate from what you learn on the job. I mean, and I tell everybody that, like, what you learn in school is important. So study hard, work hard, get the general concepts. But man, when you go to school, it's like, I mean, you're stripped bare, basically, and,
Right.
and you're just laid out to dry, basically. And, you know, that's with good preceptors and good coworkers or not, because your whole self is out there, and basically your decisions matter. How you respond in an emergency situation matters. How you support your coworkers matters. So, you know, you're being called up to task, and you know, who makes it, you know, does really good, and who doesn't, they just fall to the wayside. And then they, you know what? Then they end up finding out that the ICU isn't the end all be all, you know? And so as I transitioned out of that, you know, I did have some mixed feelings. Oh, you know, am I going to be less of a nurse? You know, am I going to be less credible? Is this going to hurt my career path?
So there's this stigma within nursing that depending on what level or where you are,
Specialty.
what specialty you do, like there's different, I don't know what to call it, respectability based on what roles you play as a nurse?
I'd say that's a correct way to categorize it. I mean, it really is. Now, again, that's what I was told, but again, it depends on the circle that you run with, right? And so I don't know if that's been everybody's experience, but for me it was. And, you know, for me it's really done well.
So is there a difference? Let's say I go to nursing school tomorrow.
Yep.
And I want to be a nurse that assists in surgeries.
Okay.
Like that's my thing. Like
Yeah.
I don't want to be a surgeon, but I want to be the nurse that,
surgical nurse.
right. Would there be like a certain path that you look at, like depending on, or if you want to be in maternity, right?
Yep.
You want to be a nurse there. Are there different paths you should look at when you graduate to go, okay, if this is where I want to end up? Because I shouldn't say nobody. Very few will graduate and then get the nurse's job that they wanted, right? Like they have to work their way to it sometimes.
Nowadays, I'm telling you, they're so desperate. I mean, the retention rate for nurses now is, I mean, I think it's down some crazy percentage, like
Yes.
18%, 20% compared to where it was just a few years ago. So nowadays, maybe they could.
Okay.
But in general, I get what you're saying, and you know, there are paths. You just have to find the right people and ask the right questions. And it is valuable having an idea of where you think you want to go, but being very open-minded and very flexible in the idea that where you think you want to go maybe isn't where you should go.
Right.
A perfect example.
You don't find out until you start doing it, right?
You don't find out until you start doing it. And really, it could even just be, it might be the right role for you, but you don't have the right preceptors. Because again, you don't have the right coworkers. You don't have the right support staff, if you will, higher and lower, you know, because it really is a team effort anywhere you go. You know, all of those things play into it. Maybe it's the right job, but maybe you just need to be in a smaller hospital. Maybe you need to be in a teaching hospital. So there are different aspects. For me, knowing that training was often shortened for some nurses in some situations, I chose the ICU because it's the most complex.
I was going to say there's no shortcuts when you're in the ICU.
There's no shortcuts. I like intense. I like to push myself. I like to jump in the deep end. The ratio is very appealing, 1-to-2, one nurse to 2 patients. Sometimes it's 1-to-1 for very good reason. So what I was getting to is, you know, I've had some people come into the ICU and then really have their heart set on it and then feel some sort of way about this isn't for me. So it makes you question, am I a good nurse? Well, what does that mean?
Right.
You know, yes, there might be people judging you saying you're not a good nurse, and it's not even that. This just may not be the fit for you.
Right.
So I've had some people go to step-down units or to maternity, or one of my good friends went to NICU, the NICU, which she loved. She loved intensive care, but she preferred it with babies and families. And myself, you know, I transitioned out into home care and, you know, a research and development company looking at preventative models of care. So, and I actually found that to be the most rewarding.
Right. So
And I actually feel more of a nurse now.
than you
funny enough.
did
I did. I do.
with ICU.
Yeah.
But it's funny because a lot of people don't fully talk about the mental strain that comes with these jobs, right? So, and I know because my mom was a nurse, so she worked in a nursing home
Okay.
because one of her things was she enjoyed helping people get to a final resting place gracefully.
Good for her.
Like that was her thing. And I'm
Right.
like, now that I'm older and I'm like, holy crap, I could not do that, right?
Yeah.
Like that would not be my thing.
Absolutely.
Then I have another friend and she works in maternity and she's like, it's the most beautiful thing. I get to see new babies born every day,
Yeah.
right? And it's awesome.
Yeah.
And the funny thing is, I would have thought that it was more mentally straining to help people pass or be with them during those moments. But I remember sometimes that was when she was the most energized after having those because that was what she wanted to do, right?
But right there, it's because it's the right fit for who she is.
Correct. And same thing with my other friend on the maternity. Like
Yeah.
she comes out of work most days re-energized, not sad or not emotionally drained because she's doing something she loves.
Absolutely.
Now, I do have another friend that is similar to what you did, that is in the ICU, and she should move. She should definitely move to a different unit.
Yeah. And I've known many nurses who've been in the ICU, even on night shift, for 35 years. So, the stress a new job plays, dealing with life and death situations on a day-to-day, minute-to-minute basis. It's something you're told about, but it's not something you can fathom until you're there. And it's not even just that aspect. You're up for 12 hours.
Oh, yeah.
You're making very important decisions in 12 hours. Then on top of that, as one of your previous guests mentioned, a doctor, that there's so much charting, and this goes to your own license.
Right.
So there's so many things that you have to be concerned with. Most of it's mundane, in my opinion, not directly patient related, that sucks up some of your time and energy and gets you. I mean, half the nurses I see stay after their hours just to do charting when you should be going home because in a short 8 hours, you're going to be up again, getting ready for your next shift. Right. So, so there are pros and cons to just the lifestyle as well.
Right.
So it's a very taxing job, but I wouldn't change it for the world.
So you said earlier you transitioned more into, I believe, like the home health.
Yeah.
How did that transition happen?
What brought me to that stage?
Yeah,
It was
from being ICU, hardcore
Right.
stress levels to the point where,
it was.
to something that because on the surface, it seems like it would not have the type of stress levels working in a hospital does, for example.
It doesn't have the same, but it does have its own stressors, its own value, if you will. I found. So I transition out of the hospital more for practical reasons, for family, 12-hour shifts, a husband who travels frequently or was pre-COVID traveling frequently, 2 young kids at the time, now 3 young kids. And with the nurse's schedule, I mean, I'm getting 2-3 kids up to the daycare center,
Right.
knocking on the door if they're not opening at 6 o'clock on the dot, calling the director after a couple weeks like, listen, I really got to get into work. So if they could get there at 6, that'd be fabulous because I'm there
Right.
waiting with my babies, And so, you lose that some aspect of family. Now, again, I knew what I was signing up for. So I knew the time and energy that I was going to have to put in the night shifts, the long hours. I wanted that because that's the nursing experience in my mind. But then in this stage of my life, I wanted something else. And I felt like being outside of the hospital would give me a picture of that. And I moved into a research and development company who was trying to develop a model of care based around preventative care rather than reactionary care, which is what our current medical model practices, I feel.
Yes.
Most practice that.
Well,
I don't want to say everybody, but
Correct. Most people don't go to the hospital to prevent something. They go in when something has already gone wrong.
Most people don't go to their doctors other than their yearly exam, saying, hey, how can I improve my health?
Right.
You know, what could I be doing on a weekly basis, a monthly basis to improve my livelihood? It just doesn't happen.
That's not what the hospitals are about.
But it's not what the hospitals are about, but it's also not necessarily, I feel like, what our culture is about necessarily, or society is about here in the United States. I think in other countries, they do it a bit better, a bit differently. Everybody has their weaknesses in the way they do things, but I feel like there's less emphasis, less importance placed upon self-care.
Right.
And I feel like health and well-being is all part of self-care. And, you know, it's so important. I'm terrible at it. I know what I need to do, and I'm working on it myself. So I'm certainly not a self-proclaimed, you know, expert at this. You know, I have 3 young kids, starting a business. You know, life happens, activities, friends, you know, everything, you know, caring for my parents. You know, so there's a desire in me to help people achieve that. And so I was drawn to this job. And then, like I said, I picked up per diem home health care. You know, so if I wanted a couple of extra hours, if you need extra money, you can do this. And what I found in that area is it's really stressful, but in a very different way. It just spoke to my soul, basically, for lack of, you know, better words, is it really did. I'm really passionate about it. And that's what I found, was that home health care is not.
So you transitioned from ICU to a research company to home health care.
Yes.
Okay.
Yeah.
Just making sure I got my timeline right.
That's right.
Okay.
Right. And so what is your knowledge about home health care? What when I say to you, I'm a home health care nurse, what do you think of? Or home health care services in general?
Well, I sit in I've experienced things like hospice firsthand. So, but I can tell you, when I got to experience that, the caretakers versus nurse ratio was one of the things that surprised me. Is we had people stop by all the time, and I didn't realize that probably only 1 out of every 6 visit was an actual nurse that could answer questions.
Oh, interesting.
Yeah, that like.
Now, did you find that you were still able to ask those other services questions, and that they were able to provide you?
Oh, no.
Oh, okay.
Oh, no. They were sending someone in to, hey, we're here to clean them. Okay. So that's all you did. Or they came in to do something, and then a nurse would show up. She would be there for 15 minutes and leave. Like, she was checking the IV or taking blood pressure, doing basic vitals. And then it was like, okay, see ya. And then we would get these, I guess they're called care technicians,
Right.
was what we saw most of the time on hospice. But when I think of home health care, I think of someone that is helping you with the things that you are no longer able to do for some reason. Like, regardless of what your age is, because you could
be young. I mean,
you could break both legs, and
Yeah.
now all of a sudden, like, you can't bathe yourself. You can't, so you're going to need some kind of care.
Yes.
If you don't have someone that is willing to do it, but
and it's covered by insurance, which is great.
right.
So I'm going to go back to something you said, because I think you bring up a very, very good point. These practitioners of all, you know, levels are coming into the home, and they're part of your healthcare journey, I call it. They're part
Right.
of your healthcare experience. They create the environment, you know, with which you see the services, with how you see the recovery of your loved one or yourself, right? It paints color, it paints, you know, feeling into the whole experience, and it could be good or bad. But it sounds like for you, I heard there was some limitation to it, right? Whether it be knowledge, whether it be touch points, whether it be
Not only
interaction.
that, it was also lack of coordinating information, for example, right? Like, getting information that we had from the doctor somehow it became our responsibility to remember what the doctor said about the things that weren't actually documented. And then we had to make sure that the nurse had it, and the nurse had to write it down, and then she had to pass it on to everybody else.
It's almost like playing telephone. Do you remember doing that in grade school?
Yeah,
where you're like, you start out with one message, and then it gets even like 2 or 3 people
Yes.
down, and
The message is all messed up, right?
you know, I could be talking about rainbows and butterflies, and third, fourth person down
Yes.
is talking about a scary clown, and
Yes.
it's like, how did that even transpire? But that's life.
And then it got even worse because my dad, for example, got cancer while he was living in another country. Trying to get an update on what his actual health was,
Oh gosh, I couldn't even
right?
imagine.
It
must have been so terrible.
Being here, there's no one to call. So I'm relying on my father to tell me what the doctor said. After he was in there, eventually someone started going with him. And even then, the information that came through between my dad and the person that went with, and then, asking both of them, well, so what did the doctor say? Well, the two of them would give me completely different information, only to find out 3 months later when the doctor actually called a family meeting that neither one of them had properly recited what the doctor had told them. And you're like, how the hell did that happen?
Well, first of all, let's see. How old was your father?
He was only early 60s.
How good was his hearing?
It was pretty good, but his memory was...
And that's the other thing.
And he was the ever optimist,
Good for him.
right? So the doctor flat out told him, you have 6 months to a year left.
Okay.
And there's a very small chance we will be able to do anything. So he comes home and says, so there's a very small chance that they will be able to fix this.
I'm sorry, I'm not laughing at this situation, but
No.
But seeing your face, you're probably like, wait, that sound like the
That-
tone,
I'm like-
your facial
I'm like-
expression
I'm like-
doesn't match with the message.
I'm like, wait a minute, you have stage 4 bladder cancer. There's a little chance they may be able to, and you're past the point where they can do surgery. The chemo already hasn't worked. I'm like, but you heard there's a small chance that I may get better.
But what you're saying is very much what drove me to where I am today. I mean, it's just one piece of the puzzle, but there are gaps in the healthcare system as a whole. And everything you just said speaks to that experience. You have doctors for each part of your body, specialties, specialists for good reason. But if they're in the same health system, they can see other doctors' notes. But how often are they really looking at those? And I'm not criticizing doctors. Our system is not set up, from the way I understand it, to focus on patient care, patient education. I mean, that is part of it, but there's just so many other things that these other, healthcare providers have to do, that the face-to-face time, the research time, the individual time is just so limited. That are they looking at those other doctors' notes? Now, if the doctors are in different health systems, then their notes typically won't transfer easily.
Correct.
And then what do you do? And then on top of that, sometimes you don't even know the doctor's name of your loved one, because again, it's your elderly mother. It's your,
yes, especially if you're doing this for someone else. Yeah, you have no clue half the time.
You have no clue, and so
it's hard enough for yourself. I've been through the experience where I ended up in the hospital and I talked to a neurologist, and at the time I was having massive sinus issues, and I kept bringing that up to the neurologist. The neurologist was like, I don't know, your sinuses are not affecting whatever this is, blah, 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 blah. So I go to my sinus doctor and I told him what happened. That doctor looks at me and goes, yeah, that's probably a direct result from your sinuses. I'm like, but the neurologist said I may have a tear in my brain that's leaking brain fluid. And she's like, what? And I'm like, no. So what we found out is that my sinus issues were actually causing hemiplegic migraines.
Oh, interesting.
Because when they fixed my sinuses, the hemiplegic migraines pretty much went away. Oh. But once again, there was no medical professional that I could use that was kind of like my person.
Yes.
Right? Like, I didn't have someone that I could go talk to and say, listen, I need you to pull the reports from the hospital. I need you to pull the report from the sinus people. I need you to pull the reports from my doctor.
Yeah.
And then I need you to sit down with me and explain this. Because first of all, I don't understand what half of these diagnoses are.
Or how they relate.
Right. So like, and I was lucky enough that I have nurses around me.
Yeah.
And honestly, they were more helpful than most doctors when it came to like.
We just have more, I don't even say we have more time, because really we don't. Especially depending on what area you work, you really have no time. You know, med-surg nurses have 8-9 patients, which is just absurd. You know, you barely have time to just give medication, let alone educate your patients. So that aside, you know, the nurses, we care. We want to make sure that we educate you. That's what we're passionate about. We're passionate about caring for you and making sure that you leave with an understanding. But that understanding we can leave you with, and some are better at it than others, time permitting, you know, is still just a part of the puzzle, a small piece of the puzzle, really, because, you know, do these nurses have an idea of what life outside of the hospital is? They have it from their own perspective, but really when I moved to home health care and this other company I worked for, where I had a patient load that I followed, and I had 60 patients, and I developed a relationship with them. It opened my eyes to, oh my gosh, like I thought I was really educating them well in the hospital. I thought it was something I was passionate about, so I really made sure I had time, made sure everybody had an understanding. If I thought somebody couldn't hear me, I made sure I told 3 other people. Knowing the telephone effect, right, as I'll call it, I made sure I educated everybody, and I tried to have everybody in one place. And then going out into the home care world, you start to realize you can educate them as well as possible, but as soon as the discharge happens, it's all it's like all hell breaks loose.
Yes.
For some people.
And it's the selective portion of what they heard, right? It's my dad coming home saying, oh, they think they can fix this.
Well, when you hear a traumatic, you know, diagnoses, your mind fixates, for most people, I would imagine, and then spins on that.
Yes.
All of the other words now are in the periphery, and you have no idea what's being said.
Correct. And there's no documentation really other than the diagnoses. There's very limited. Right.
What is said in person does not equate in any way to what's on that piece of paper. It's very limiting what's on there. And so here comes my business, you know, and just.
I was just going to ask you. So you transitioned
So this is where I transitioned into, and it's not even so much just about my business, but there is this niche area of healthcare that I started learning about and realized is so valuable, but is so not even seen or heard. So my goal in my business is to fill those gaps as best as possible, to be your guide, your navigator, your collaborator in those processes, and I'll explain to you how. So your example, let's use you. You went into the hospital. Now you're an intelligent, you know, well-adjusted person, strong family, you know, strong support group. So you would think that you should be fine. You feel like you should be able to understand what the doctor's saying, and you did to some degree. But you have these other symptoms, right? So I look at it as I know the elderly population can certainly use this from many perspectives, but even people your age, you know, having somebody in your corner who has hospital experience, who has nursing experience, who has home health care experience, who understands the discharge process, who understands the limitation in the information, who understands how to listen to a doctor, ask appropriate questions, what documentation is necessary to request, what the likelihood of the transition process going smoothly is, and then what services you may want to need at home, and what extra help that may pan out to be. So for you, yours was fairly cut and dry. You knew to go to another specialist. Well, let's say the neurologist is telling you this thing, and this often happens, which again presents some level of distrust or uncertainty of patients, right? I'm not telling you I'm going to go in and know the answer, but what I'm going to tell you is that I'm an investigator. Like, that's what I do. Like, I investigate everything. I need to know the why, the how, the what, and then what options are out there and how those all interact. So for you, if you were telling me that your sinuses were hurting and you had these migraines, I would be there with you in the hospital. I would come visit you in the hospital. You're a little bit different because you were able at the end to communicate to them what your living situation was. You needed very limited services.
But even just to interrupt you, but even questions like neurologist comes in and goes, okay, so let's start from the beginning. I'm like, beginning of what?
Absolutely. They're very, I agree with you. I even find myself stumbling over it. So do you have any troubles?
Well,
are you talking about emotionally, spiritually? Like, where are we starting here? And like, how narrow do you want me to focus? But you're right. Like, those very broad, open-ended questions, especially for an elderly person, is entirely confusing.
Oh, yeah.
And then they start to stumble. So my role is, here's a list. Here's your whole medical history.
Right.
Because through building a relationship, I have all of this information for you. I will have a hospital binder or pamphlet for you to take in that lists all of your current medications, when you started them, because that matters, right? Not just being on a medication, but how long ago did you start it? Because maybe that could also play a role in what's going on with you now.
Right.
How many times are you asked exactly when that started? When do people pay attention to that? Some do, some don't. It's just a crapshoot, again. So I provide that for you. I come in and I help be that conduit. And then I also talk to the case managers. I've had a patient, I'm fine to go home. So I call them up. I had already visited him in the hospital, made sure I talked to the nurses, make sure his medications were right. They weren't right. There were some that were missing.
Okay.
Or they were being given not in the right order. He was taking them in a certain order for a certain reason, prescribed by his doctor specifically that way. He was in a health crisis, so he wasn't able to communicate that properly. He tried to get most of the medications. So long story short, we get that ironed out. I tell the case manager, he's not safe to go home. He lives in a 2-story home. He has 10 steps going into his house. But in his mind, he could hobble up. He had a lower extremity injury. He could hobble up an injury, mind you, that started as a foot wound. Tiny little foot wound. It'll be fine. I'll just clean it up with some hydrogen peroxide. And it grew, and it grew, and it grew. It got infected. He ended up having part of his leg amputated. So had I been in there earlier, or a service similar to mine had been in there earlier, anybody else consistently been in there earlier, we could have avoided that. So there's so many aspects to my job that it's like, how do I even explain to you? I mean, I said it to somebody the other day, and I think it's accurate. I'm your nurse. I'm your personal nurse. I'm your personal assistant, and I'm your daughter.
Right.
How do you wrap that all? I mean, that's literally what people need. They need a connective thread through every specialty.
But yet, because you really are a third party, you remain neutral most of the time. So you don't get emotionally invested in when the doctor says something. You keep looking for facts.
I look for facts and
while the
figures
person
and
sitting there is stuck in the emotional aspect of it. And
100%.
a lot of times it's not just the patient. It can be the family member.
It's often the family member. It's anyone involved. And again, that's just another aspect of the job or the service that I provide is, I work with the person, the patient, the client, whatever you want to call them, to help develop a plan. What is your plan? What is your plan for life? You meet with a financial advisor, insurance, you make a plan to go on vacation, yet you don't plan your life, and people fail to see that it is necessary. Aging is a beautiful journey, can be a beautiful journey, and it always feels better, more empowering when you have a plan, when you know your directives, and then and you've educated the people in your support circle. So families come in, she wants everything. She wants a feeding tube. And then there they are. This person expressed many times, I don't want to be a vegetable.
Right. I don't want any of this.
I don't want any
like
of
the
that.
family members just drew assumptions.
Yeah.
So it sounds like, just to kind of wrap this up, is if, for example, like let's take my situation where I was hours on a plane ride away from someone that needed pretty intensive care,
Oh,
right? Like
absolutely.
in order to stay up to date, in order to even know what was going on. Like, so what you're saying is I could have hired someone like you, for example, with my dad's permission and said, hey, listen, I just want to have someone that is there to look out for you and you only
Yes.
through the entire process, right?
I am their advocate.
If she can report back to me just so I know what's going on, I would appreciate it. But really, I would have then had my own nurse involved in the process so that I would get actual information. So I knew whether or not I needed to fly home now to go say goodbye, or if I could wait 3 months to go home and say goodbye, right? Like, or make sure that he was actually properly taken care of, because that was one of the things we found out when I made it home the one time. He wasn't being bathed properly because he was uncomfortable around the nurse.
Oh, so he did have services come
He
in,
had
but it was not.
absolutely, but
Yeah.
like there
So
was
you think that services are in place,
well,
and they are, but
they aren't being done properly, and it wasn't the nurse's fault.
Yeah.
It was, but that was not something anybody mentioned until I came back, and I was like, why is this like this? And he's like, well, I'm like, well, you should have told someone this 3 months ago, right?
who's comfortable telling people what they want to need?
Right.
I mean, I often hear people don't know what they want. They don't know what they need, and they certainly don't know how to speak for themselves. And so I am your voice. So in that situation, I would have noticed immediately, just because I feel like I notice
Right.
everything in every situation. But to say, Gummy's dad, it appears that you are very uncomfortable with this. Who would you be comfortable with?
Yes.
Would you be comfortable with an elder woman helping you, an
Or
older
a male nurse, or like whatever.
or,
Yes.
or your sister with assistance from the nurse, or your brother or whoever else, and
Yes.
then put that system in place, because ultimately that stress that he's experiencing that moment affects his healing.
Correct.
So
it's
stress-
making
yes.
his condition worse, not better.
And then it's making your situation worse
Yes.
because you're stressing. So your two most valuable assets are your health and your time. And my service is there to help ease those, right? To give you back some of your time so you can refocus on being the son and not the caregiver. That's not to mean that you're not playing an active role, because I am not the end all be all, but we are a team together, and I will find out everything about the healthcare process, his services, what's working, what's not, facilitate that with your permission, with his permission, whoever the key stakeholders are, make sure everybody's kept abreast of what's going on. I'm there to educate, to provide knowledge, to provide insight, to be a sounding board. I certainly don't know everything.
Right.
I'm not presenting that. But what I'm saying is that I understand enough to give you the information that I know I have, and then to point you to the right resources in situations when I don't have them.
So this comes back full circle to where we started, is nurses are often the ones that are the most rounded when it comes to this stuff, which is part of the reason you can now do what you do and be that neutral intermediary that can listen to all aspects: the patient, the family, the doctor, the home health aide, whatever it is. You become kind of the central point as the nurse.
Absolutely. And 100%, not just me, but nurses in
but
general.
nurses in general, like
Yep.
people don't realize they are often the central point in all of this.
Because we're the touch point. We're there by their bedside.
Correct.
I mean, my patient,
and the
I have to
doctor
do.
talks to you,
I
and
have
the
to-
family talks to you.
I have to
and-
do
correct.
every 15-minute blood sugar checks. I'm there. I'm
Yes.
there when the caretaker comes in, the doctor, the physical therapist.
Right.
I don't let the doctors come into my room unless they are telling me
Correct.
what's the story, because as you said, if I'm not there when they speak it, I don't often know it.
Right.
And so if it holds true for me, who's in healthcare, what does that say for the families experiencing it, right? So you wrapped it up, and the most important aspect though too is that all of these pieces are valuable, important in the healthcare process. I'm not here to take those places. I'm just here to help facilitate, optimize that experience. because each one of these specialties have something important to bring to the table.
Yes, they do. So,
But, I still vote be a nurse.
well, thank you for coming in.
Thanks for having me.
And I'm sure we'll bring you back for another episode to talk more specifics about some of these things.
I look forward to it.
And thank you to all the listeners.